agents are used for treating fungal infections, their spectrum, the targets and the toxicities are different. So let's begin with Griseofulvin. It has a narrow spectrum of action. They are specifically active against dermatophytes, a group of fungi that infects the skin and nails. So Griseofulvin is used for treating superficial skin and nail infection. Common uses are Tinea capitis, Tinea corporis, Tinea pedis, onychomycosis, which is infection of the nail. Coming to Amphotericin B, it has a broader spectrum of action and it is used for treating systemic mycosis, which is caused by dimorphic fungi such as histoplasmosis, blastomycosis, coccidioidomycosis, sporotrichosis. It is also used for treating opportunistic fungal infections such as candida infections, candidemia or disseminated candidiasis. And it can also treat cryptococcal meningitis in combination with flu-cytosine, which helps in the penetration of Amphotericin B into the cell, increasing its efficacy and decreasing its toxicity. So cryptococcal meningitis, where Amphotericin B is administered intrathecally. It is used for treating aspergillosis, particularly in resistant cases when other antifungal agents fail. It is the drug of choice. It is the first line drug used for treating mucormycosis. So in case of mucormycosis, Amphotericin B, particularly the liposomal formulation of Amphotericin B, is the drug of choice. Protozoal infections, Amphotericin B can also be used for treating visceral leishmaniasis. So how do these agents work? Griseofulvin has a unique property. It gets deposited in the keratin-rich cells, in the keratin precursor cells such as skin, hair and nails. As we can see in this figure, it gets deposited. It has high affinity for keratin-rich tissue, gets incorporated in the keratin of the skin, hair and nails, and it inhibits cell division. Because it gets attached to microtubule associated protein, it inhibits the formation of mitotic spindles, thereby inhibiting cell division at metaphase. So Griseofulvin acts by inhibiting cell division at metaphase by inhibiting microtubule formation, and it acts because of its property to bind to the keratin-rich cells of the skin, hair and nails, and therefore they are used for treating superficial infections of the skin and nails. How does Amphotericin B act? Amphotericin B has property to bind to ergosterol, which is a component of the cell membrane. By binding to ergosterol, by inhibiting the synthesis of ergosterol, it forms pores in the cell membrane and causing leakage of ions and leading to death of the fungal cell. So Amphotericin B acts on the fungal cell membranes, forming pores and death of the fungal cell. So it is fungicidal in nature, whereas Griseofulvin is fungistatic in nature. So this is a difference in the action on the fungal cells. The next is what are the different routes of administration and formulations of Griseofulvin and Amphotericin B. Griseofulvin is administered orally, and it is to be noted that fatty food enhances the absorption of Griseofulvin, increasing its bioavailability. So Griseofulvin, when administered with fatty food, the absorption increases, the bioavailability increases. In case of Amphotericin B, the most common route of administration is intravenous route of administration. However, they can also be administered intrathecally for the treatment of fungal meningitis, specifically cryptococcal meningitis. So in case of cryptococcal meningitis, Amphotericin B can be administered intrathecally in combination with 5-flu-cytosine. With respect to its formulation, the most conventional formulation is Amphotericin B deoxycholate. There are various lipid formulations or liposomal formulations of Amphotericin B that are available, and the reason is because Amphotericin B is toxic. So we'll be discussing the toxicities of Amphotericin B in a while. So because of the toxicities and to reduce the toxic effects, Amphotericin B is available in liposomal formulations, and these formulations are commonly used, and these are liposomal Amphotericin B lipid complex. So these are some of the liposomal formulations available to reduce its toxicity and increase its efficacy. Next, speaking about the toxicities of Griseofulvin and Amphotericin B, headache is the most common adverse effect of Griseofulvin. GI upset can also occur, and photosensitivity is a rare occurrence. To be noted that Griseofulvin is an inducer of cytochrome P450 enzyme, and because of its enzyme induction property, there is decreased effect of drugs that are administered along with Griseofulvin, and these drugs are warfarin and oral contraceptives. So the efficacy of warfarin and oral contraceptives decreases because of the enzyme induction property of Griseofulvin. Now coming to Amphotericin B is a life-saving drug which is used for treating serious fungal infection. But here's the catch, it cannot be given orally. It is administered intravenously. Infusion reactions are common with Amphotericin B, and this is due to the release of interleukin-1 tumor necrosis factor. These are cytokines that are known to cause fever, chill, rigor. So Amphotericin B, most common reactions are infusion reactions. Nephrotoxicity is a major concern. It can seriously damage the kidneys, leading to rise in blood urea nitrogen, creatinine, and therefore Amphotericin B should be used with caution in patients with kidney disease. It can also cause damage to the liver, causing liver dysfunction. So liver dysfunction is also a possibility with Amphotericin B. It can cause disturbance in the electrolyte levels, electrolyte imbalance such as hypokalemia, hypomagnesemia can also occur with Amphotericin B. So Amphotericin B known to cause infusion reactions, nephrotoxicity, liver dysfunction and electrolyte imbalance. So these are some of the toxicities to watch with Amphotericin B. You should know the risk, weigh the benefits and then use Amphotericin B. So these are some of the key differences between Griseofulvin and Amphotericin B. Thank you so much for watching. If you like this video, please share and subscribe to this channel.